So one of the key things that we've done in our partnership and preparing for our rollout is to look at the audits. And as an organisation, as you might expect, we have a number of audits that we either are obliged to do by our regulators or need to do to improve care. But auditing for us has been largely paper-based with a few internal developed apps. Now, the problem with that is that certainly our paper-based auditing doesn't give us the oversight of what those audits are actually telling us. So whilst it serves a function at a home level, across the company and to identify what we need to do to support homes, we don't get that oversight. So we were thrilled and we delayed our work on the auditing, so Radar Healthcare released its new audit module, which has given us an incredible flexibility to build our audits, refresh our audits, bring them in line with national guidance, making them really meaningful to people. And now all of our audits will be in one place. The managers will be able to do these very, very easily through a really simple platform on Radar Healthcare, and we'll get the power of those audits. So as an organisation, we'll be able to understand what it is we need to do to support our homes.
Yeah, no, the kind of audit functionality is, and what was really refreshing is, and maybe you can, touch on it a little bit, was where you, instead of it just being a checklist, there's complexity within audit that you've got to underpin from a functionality perspective, and we do that. But the interesting thing from a HC1 and this partnership was that when people are running audits, and I'm going back to the thirst for, is they see it very much as, how am I going to use this function, the auditing function, to help identify to me where I need to improve, and that I can also link in the actions, I can feed it into the analytics. Did I affect the change that I wanted to? So the next time I run it, it's going to give me that outcome or that kind of indicator that I'm achieving those outcomes. So it was very much moving from a yes, no, am I meeting this requirement, to yes, no, but do I feel it's meeting the requirement from me and my home? So I know, in terms of how you talk about assurance rather than yes, no. So
what we've done in working with the audit module is to completely change the language. And as you quite rightly say, auditing traditionally has been yes, no, and is a tick box exercise, to a certain extent. And some of that's been driven by the need to achieve regulatory compliance, etc. But actually, if you use auditing in its true sense, it should identify where you need to improve, that then links to the Radar integrated action plan. So we needed to change the language. So now our audits are asking managers to say whether they're assured or not. So I am assured that my linen cupboard is stocked fully. And if you're not assured, it doesn't matter. It doesn't matter at all. What matters is the action that follows. And so what we're asking managers to do is say not just yes, no, but I'm assured or I'm not assured. And if you don't feel assured, let's work together to find out what the improvement needs to be. And I think that's going to be quite a powerful message that we're going to work through.
Yeah, I think culturally as well, just that shift from I kind of want to get lots of greens. Well, actually, a shift to moving to this, and that's certainly something that we've thought about when we're working with the likes of yourselves when we've been developing the enhanced audits, is how does it give you a true indication? And I think that culturally, where I'm almost encouraged, and it's held up, as an exemplar to say, I've identified these areas where I'm not fully assured. So therefore I'm going to put more in. Whereas historically I could have just said, well, yes, theoretically, so I get a green.
Yeah.
So no more C's of green.
No.
Well, actually I'm getting C's of, here are genuine areas that I need to, embed a further assurance before I feel that I'm fully compliant or where I want to be.
Absolutely. So it goes back to that language. It's taking away the drive for 100% or pass-fail, which is some of our traditional audit kind of language. And then we count how many 100% we've got or how many passes we've got. And then we almost sort of view a fail or something less than 100% as a negative. But actually, we need to do it the other way around. And actually, we need the audits to identify the improvement. It's inconceivable that there's not a single home in our portfolio that cannot identify improvement through its auditing process. So what really matters is that we do have audits that are in the old language failing or are less than 100%. Because all we want the manager to say is, I'm just not assured. So I need to then go and identify the improvement. And I think then we'll get a much better view of the improvements we need to make. And the benefit of Radar Healthcare for us is that then seamlessly goes through to the integrated action plan, where the manager then has a really clear focus on what he or she needs to do to make that improvement. So when they rerun that audit, it's in a better position, and then they know they've made that improvement.
Yeah, and again, having a conversation here at Douglas View was around what are the precursors to an audit. You've got your scheduled routine audits, but then how do we know when should we audit? So we were having the conversation. So Radar Healthcare's analytics helps you identify where you might have trends or deviation. And then even within the action plans that you mentioned that are integrated, being able to identify and linking where I can see a specific action that it almost self-prioritizes the action, because that action might be related to multiple incident events. It might be linked to multiple audits that's identifying. So helping home managers prioritize.
Yes.
Because, time is one of the most precious commodity in healthcare. So being able to help focus and prioritize some of that, and then measure the effectiveness of that action. Yeah. So
and what you described there is, really important, because each one of our homes is very, very different. There are no two care homes the same.
Yep.
And they will have different things going on and different sets of circumstances all the time. So the ability to give people the information so that they can, apart from the scheduled audits, use auditing effectively to drive improvement, and then understand the priority of that through the action plan is incredible.
Yeah, and then the flexibility of the audits already. I was hearing conversations as part of this partnership as to what, if you think about it and I know this firsthand from a regulatory perspective, where you see organisations that get rated as outstanding and the best of the best, is that there's a step of going beyond what's prescripted within an audit. So already it is, and one of the insights and that's first again from a HC1 perspective is, how do we enhance those audits to further drive improvement? What additional checks can we incorporate that are a true measure of quality? Again, using the resident as the anchor of that.
Absolutely. It always comes back to the resident. What is it that gives the resident the best quality of life? And it's not the driver is to satisfy a regulator. That will follow if you do that properly. And as you say, to build audits in such a way with the flexibility in our partnership and the system, we've been able to build the audits that drive to that outstanding level of quality of care.